Should I check this out?
Yes, no.
This one?
We have got some background.
Yeah, no? This link has been shared to the doctor, right?
I don't know. Good morning, Dr. Mukim. We'll just test your audio and video before we start.
Yeah, good morning. Am I audible?
Yes, you're audible. Okay, yeah, video is fine also. Okay.
Yeah. Hello. Oh, nggak mau join, nggak join nanti. Oh, tuh. For you make me the host, no? For sharing the screen sharing.
Yeah.
Yeah, later on, yeah.
You can share it, yes.
Yeah.
Please. Okay, good morning, everyone. And on behalf of the Mentoring and Value Education Cell of Shillong Commerce College, we're very delighted to have this program this very day, this very time. And we are very happy to have with us here in this program our very well-known resource person, and that is Dr. Eddie Mukim. And so, Doctor, we welcome you at this time. And on behalf of the principal of Shillong Commerce College, on behalf of the vice principal, the teaching and the non-teaching staff of this college, we welcome you, sir. And your availability with us here shows your spirit of humility towards our students. And we look forward to a meaningful interaction with you. And our students are here with us. And with me here, there's our assistant professor, Mr. Mantre Prasad, who's going to help me. And before we start off, I would like to just ask Sir Mantre if the students are ready. So far, I'm seeing only 93 participants. Okay, so Doctor, we have about 95 participants with us here. And we know that the students are just waiting and eagerly waiting. Because as per the topic that has been highlighted here, it's on the importance of mental health for students. I think this is a very, it's a very apt and a very needful topic that we need, and especially our students require today. In a day and age where many students are, they're not only sharing, but looking for counselors to address the mental issues and mental problems that have arisen out of so many causes. It can be family, it can be this or that. So just to remind us that just recently we celebrated this International Women's Day on the 8th of March. And we saw how even the United Nations has taken the issue of women so seriously, the issues of women. And this time when I look at mental health also, I saw that the theme for this year's Mental Health Day, which is going to be celebrated on the 10th of October, it's mental health in an unequal world. So I think we really understand the dynamics of this issue, mental health. So Doctor, we give this time to you and we look forward to a meaningful interaction and talk with you. So the time is yours. Thank you so much. I request all our participants and students to please unmute your phones. Resource person. Oh, resource person?
Oh, yeah,
You have to
sorry,
unmute.
yeah.
Yeah, it's okay.
Yeah, good morning, everyone.
Okay, at the same time, Doctor, let me just interrupt. For the sake of all our participants, Dr. Eddie Mukim is I think what I learned is you're a consultant psychiatrist at Sun Care and also helping with the Roberts Hospital.
Yeah, that's true.
So if there's anything more to that, you can share yourself.
Oh, yeah, sure.
Okay, thank you.
Yeah, so thank you once again, Chairperson, for the kind introduction. I hope I'm audible to all.
Yes, absolutely.
Yeah. So I've
just your video.
I'm a psychiatrist working in Sun Care and also in Roberts Hospital. And I want to thank the Shillong Commerce College, all the participants, the Mrs. Sen, the Dr. Sen, the principal, and all the other members for having a burden for this issue, mental health, which is something very needed nowadays. And usually it's a taboo subject to discuss about mental health and mental illness. I think we have a counselor, Dr. Badriti there. I think she'll vouch for that. But during the pandemic, COVID pandemic, it's been a devastating time for all of us, for the whole world, for each one of us personally. But one good thing that has come out from this pandemic, I feel, is that this issue about mental health and mental illness has come to the forefront. The stigma and shame regarding these things is less now, even though it's still there. But over the past 2 years, we have seen people talking about the need to promote mental health, to let it come, not to be ashamed to talk about it, and to seek help as needed. So that's one thing that has come out of this pandemic, at least as a psychiatrist, is something which I welcome. And I want to thank also once again the Shillong Commerce for this organizing this program to promote mental health. I'll just be sharing the screen. 1 minute. I hope it's visible screen.
Yes, doctor. Yes,
the importance of mental health in students is a topic given to me, and I want to be more interactive. If students, if they want to unmute, also they can ask questions. You can ask questions, and you can write down the questions in the chat box also, and maybe we'll have a Q&A at the end. But just as
doctor,
starting now,
that's good.
Importance of mental health in students. What do the students feel from Shillong Commerce College? Is it something that we need to discuss? Is it something that is needed? Or we are all busy with our studies after the pandemic? Maybe one or two can share before I continue with my talk.
Yes, students, if there's anyone who would like to share something?
Importance about talking about mental health in this current scenario?
Is there anyone out there who would like to respond to a doctor?
We can have a more interactive session.
Absolutely, yeah. It'll be more lively also, doctor.
Yeah, more lively session.
Yeah, exactly. I think our students are very shy.
I think you have Dr. Badati Ringa with you, no? As a counselor there.
Maybe, but you can share something about our students, the mindset of our students, or the overall picture of how our students are. Have you come across students who are concerned about this mental issue or have mental issues or whatever it is? But maybe you can just give a line or two.
Okay. Thank you, Ms. Mevada. Yeah, well, our students is a little bit shy, but they need a lot of encouragement also on our part. That, of course, what we find, they really have issues with, mental health issues, I should say. So they really need a lot of help, encouragement, support from all of us, including from the family side, parents as well, and siblings, and from a college side as well. We are trying our best to help our students. So, well, I would like to encourage the students to please open up at this time, because this is a privilege for all of you to share anything. Feel free to share this program is mainly for you. We are there for you to help. It's okay to come forward, come forward to just say something, because this is the best time for you to know more about mental health. Actually, it's normal. You know, it's normal to have a. I mean, if you share something that sir here, Dr. Eddie Mokem, is willing to help you with this, like to make you more understand about what is this mental health. So I request all students to please participate. Thank you.
Okay, thank you, Bharati.
Thank you,
Yeah,
but
so students, if they have
Welcome.
questions, they can just write down in the chat box. We can have
yes, absolutely,
Q&A
yes, you can do that.
later on. But
So
yeah, so
students,
mental
please
health
do that.
students. Yeah.
Yeah. Okay, go on, doctor.
Yeah. So mental health in students is something very important, especially after this pandemic here. As I work here in Sun Care as a psychiatrist, previously we have seen that usually most people who come are those who are will have severe mental illness. They are called psychotics. They don't realize that they are ill also. That has been our experience in the past. But with the past 2 years with the pandemic, we have seen that more people, those who have come mainly with something called neurotic illness. I mean, these emotional problem like depression, anxiety, worries, fear, has become more and more common, and even suicidal thoughts. And and the pandemic has really affected all of us, and especially the students, the worries about the future, the career, the exam phobia. There's so much stress and tension over the past 2 years because of the COVID, and that has really affected people with, especially those are at risk for mental problem. So one carry home message from my talks that for all of us not to be ashamed to say that we have an emotional difficulty or psychological problem. I mean, the pandemic has really affected each one of us, including myself. So we should not be. We should be willing to seek help and be willing to talk to professionals, or maybe just any. It might be our teachers or anyone. If we have any mental health issues, because the earlier we take it, it can be managed more easily. So we cannot say that no, I don't have this problem. If we don't have, yeah, we thank God for that. But then studies have shown that over the past 1 year, many students are going through a lot of mental health problem, and sometime will be discussed what are the signs, how can we detect these issues, so that these some red flags, so that as we detect it earlier, it can be managed more easily. So that's why the mental health and mental illness is very important to discuss nowadays. Okay, so mental health is a vital component of our day-to-day life. I think we all know about that, no? Of course, physical health also is important. The WHO Constitution, WHO's World Health Organization states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So when we say we're healthy, it's not that we don't have any disease, but a state of complete physical, mental, and social being. So not just physical health, but even importance of mental health. I think we all understand that, no? Mental health, if we have worries, if we have depressed, we cannot sleep, then it affects our studies as students. It even affects us physically. People who have depression are more at risk for heart disease, more at risk for diabetes. So mental health affects the physical health. And for students, yeah, as I said, if you cannot sleep, then you're not able to concentrate on your studies, you cannot enjoy with your friends. It affects the different way of our health. So first we have to know what is mental health. When we say mental health, what do we mean? So mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make contribution to his or her community. So that is mental health. When we say we are mentally well, emotionally well, it means that we understand our own abilities, we can cope with the normal stresses of life which we face, including the pandemic of last year. We can work productively and able to contribute to our community. So that is mental health. So each of us has to look at ourselves and see, are we mentally healthy? So what are the causes of people of the factors which lead to mental health? No? How can we be mentally healthy? So there are lots of different social, psychological, and biological factors also. Social factors, no? Having friends, a supportive family, those who are alone, those who are aloof, might have more emotional problem. Then psychological factors, from childhood. Some people tend to be shy, they tend to be timid, some have anger problem. So all these psychological issues can lead to a good mental health or a negative mental health. And even biological factors. For example, any diseases, a disease of thyroid. A thyroid is an organ in the body, in the neck, in front of the neck, which secrete the thyroid hormones. So so people who have less thyroid, they call hypothyroid, are more prone for depression. So even so the physical factors also affect our emotional health. So when someone has a mental problem, we have to look at all the factors, not only just family problem, not just psychological issues, but even the physical or biological factors. So all of us have normal emotions, no? We tend to sometimes be sad, sometimes happy, sometimes irritable, angry, sometimes we tend to be anxious. So all these emotions are normal. But when we say that we have emotional problem, it becomes pathological when it hampers our day-to-day life. You know, when we feel sad continuously, or sometimes we feel irritable, just feeling angry. Sometimes we feel anxious, worried, we feel tense. If it disturbs us, we cannot able to sleep at night. It disturbs our day-to-day life. We're not able to concentrate, cannot study. Then then we can see that we can have some emotional problem. And nowadays, like we want to remove the stigma about because sometimes even when you say mental health or mental illness, even you use the word mental, people already feel, you know, when we talk about mental illness, they think about severe illness. So yeah, we might not like the word mental, but we can even use like words like emotional or psychological problems, emotional or psychological disorders, which I think all of us go through, and which we can all seek help for these emotional or psychological problems which we face. So the importance of mental health for students. And of course, when we say students, I think we mean many college students from the Shillong Commerce College and all the other college students. But then we have to realize that promotion of mental health should start from childhood, because all these mental illnesses that we see in adult life, no, they usually the cause is mainly in childhood. There's a genetic cause. If there's family history, they're more at risk for mental illness. And from childhood, if the child is abused or they are bullied in school, bullying is one problem that is really causing emotional problem later on in life. Those are bullied in school. We have found that. So from childhood, it's very important to promote mental health and to prevent mental illness. And that's why now even the government also has made it compulsory for that every school must have a counselor. I think previously emphasis is only on the IQ. No, I think you understand IQ, the intelligent quotient. You want the person to succeed intellectually, to get good marks, to succeed in life, which is of course very important. But then as time has gone, we have seen that just promoting the IQ to be very smart, to be good in studies, is not enough to succeed in life. We have seen many people who have very good IQ, but if they have low EQ, that means emotional quotient, or low SQ, something called social quotient. So IQ is something to intelligence quotient, how smart you are, how good you are with your studies. But EQ is emotional quotient, how you are able to control your emotions. Do you have any negative emotions like anger, resentment, impatience, not able to control your anger? Or are you calm? Are you friendly? Are you able to control your anxiety? So that's emotional quotient. And social quotient is your ability to get along with other people, no? Do you have friends? Are you able to talk with others? Can you speak publicly? Can you make relationship and maintain relationship? Have good many friends and those types. So social quotient is also something which is we need to emphasize on. So this has started in, I think, from school, for children, so starting from class 1 onwards. The importance of promoting mental health in school children. So that's what, so counselors are now trained, school counselors, no? That they need to detect the children who are more at risk. So you see some children who are more timid, anxious. They don't speak much. They don't come forward. They're the one who, if you don't help them, will have later on more depression and anxiety. Then other children coming from broken families, or children who tend to be overactive in school. They cannot sit still. They tend to move here and there. Some tend to be disobedient, lying, stealing. So these are the problem children. Well, most of them we just say, no, they're a naughty child. But then it's not just being naughty, but they need help. And if the counselor is able to detect these children, speak to them, help them to improve their EQ. There's some children who are very shy, who cannot go out and talk. Later on in life, if that continues, no, they'll have problem with doing interviews in in the career. So to help such children also. So promotion of mental health should start from students, from childhood, even school students. And then to prevention of mental illness, because mental illness from childhood we can detect. There's some, like I said, something called attention deficit hyperactive disorder. Children are very hyperactive who cannot sit still. Then some children, they're not able to concentrate in the studies. No, they want to study, but that concentration power is not there. Then in some children, they may have something called social phobia. Then these depression, anxiety can all be there even in school children. So it's something we need to detect, to manage early. And if we can do that, then we can promote mental health from childhood itself. Coming to young adults, and even the young adults, the teenage years from 13 to 19, I think which most of the students are in this, maybe above 18 years, I think, in this group. So it's a critical period in prevention and treatment of mental health disorder. The reason being, I think, is this adolescent period, no? It's a period when the brain starts maturing. There's a lot of brain development starting from 13, 14 years. It's called the adolescent age. And most of these severe mental illness called schizophrenia or bipolar, usually starts at this age, after usually this 17, 18, 19 year of age. So this time for the young adults, a very critical area to detect if anyone has problem and to manage accordingly. So globally, an estimated 1 in 5 young people experience a mental disorder. That's a very big number. It means around 20% in their lifetime will have a mental disorder. And again, when we say mental disorder, we are not saying that someone sometimes this severe one. No? So when we say someone is really psychotic or they're out of touch with reality, it's not that. But it's the disorders which are we can't say mild also, but like depression and anxiety disorder, depressive disorder, which is very, very common even in young people. So these are very common, and there should be there's no shame regarding this. Like I said, even when I like the word mental disorder, we can see an emotional or psychological problem, but then it's very common. But then in India, only 7.3% of young people reports having this problem, and few access treatment. And we'll see what's the reason for that. So it's very common. That's why it's important to discuss. And studies have shown that it's common, but then most people do not realize that they have this problem, do not seek treatment. And as they leave it like that, it can become more and more severe. It can recur later on, and it will disturb us as we become adults. Then suicide. Again, it's a taboo subject which most of us would not like to discuss. But then, like I said, over the past 2 years, we have seen that the number of suicide has gone up, especially among students, obviously because of the stress that students go through. Even though all this does not come out in the paper, what comes in the paper is just the tip of the iceberg. But then in my experience, in the experience of the counselors, many people have come talking about, suicidal thoughts, death wishes, they don't feel like living. And they think suicide, I think not the leading, is the second leading cause of death. The leading cause of death in young adults in India is accidents, usually road traffic accidents. So suicide is the second leading cause of death. So on every 40 seconds, someone dies all over the whole world of suicide. So it's someone which we need to really not feel ashamed or disregard or just sweep under the carpet about suicide, but to openly talk about it. For teachers and counselors here, I think sometimes there's a fear, that even we counsel our students or counsel someone, we should not ask about suicide, because if we talk about that, then we are putting the idea on that person. But that is a myth which has to be removed. I mean, these thoughts are not, we don't have to implant it on the person's mind. It's already there. Of course, when we ask, it should not be very bluntly. You have to do it sensitively, kindly. Maybe ask the people, do you feel sometimes there's no use to live, life is worthless, you feel hopeless? Then from there, we can go on. Have you had these thoughts, suicidal thoughts? There's nothing to be ashamed of talking about that, because it's something that I think if we ask the students, most of them would have had these thoughts, and it is common. It's not that it's if I have that, it is wrong, it's a sin, or I'm having a mental illness. It's very common, but then one should come openly, and we should not be shy or embarrassed to talk about this thing, because it's something which can be helped as we discuss these issues. Okay, so like I said, there's for the young adults, there's a physical hormonal changes leading to psychosocial, behavioral, and sexual maturation during these adolescent years. So it's a time of great change, and especially in the students' time. Why are we saying importance of mental health? Because as we all understand, the era of extreme competitiveness, study stress, academic anxiety, exam phobia has been a significant stressor for all Indian young adults over the past 1 year. Not able to study, not be able to connect online, and all the stress that students are facing. And now exams are coming. So obviously it's a time of extreme stress. That's why it's importance of having a session like this. And these type of stress, I would say, when we have this stress, one thing which is really helpful is just talking about it. Nowadays we promote something called self-help group. Groups where people can just sit together, 5 to 10 people sit together and discuss these issues, these exam issues, all this stress that people go through. There might be a counselor, someone to moderate the sessions, just sitting around and just discussing, just you sit to ventilate, let out your feelings. Just that also will help to remove a lot of stress. So something which we want to encourage in all the colleges, where just speaking one by one, Dr. Bharati, to speak in each and every student is very difficult. But having a self-help group where people can meet together and open out about the emotional problem, will go a long way in helping the students. Then other stresses, for students, high parental expectation, of course, societal demands, anxiety of social disapproval, peer pressure, uncertainty in job market has made the student highly vulnerable to mental health deterioration. I think we all understand that. Peer pressure, especially, among the students here in Shillong. If someone has a new phone, we all want to have the same phone. If someone's wear new clothes, especially for young girls, the body image all these, they want to imitate the West. That's what, especially our caste society. We want to imitate all the Western, and if you don't get what others are having, then a lot of stress and tension comes in the mind. Then there's a time when we have to have a lot of inferiority complex, feeling inferior, looking at other people are doing better than us, identity crisis. No, I'm not sure of our identity, not sure of our sexual orientation, then body stress, body image, need for independence, gadget addiction, worries about career, all these different stress that students can go through on top of the academic stress. So it's really a time of great stress that has been there since before, and much more during this pandemic. So it's something which is really a thing. But one thing I want to say here is that, for us also have this identity crisis, inferiority complex, comparing ourselves with others. One thing is not to compare ourselves with others, to know that each one of us has been created as a special person. We have been specially created by God. We are special in our own ways. We are loved by God as we are. So there's no need for us to compare with ourselves with other person. Just do your best in your studies, and trust in God. Those who believe in God, I think that's the main thing in this time of stress that we go through. And again, like I was saying, that not to be ashamed to. At the end, I'll say that it's okay not to be okay. It's okay not to say that I have problem, I'm not okay. To be willing to, if you have any more elderly person whom you can look up to. It might be a counselor, it might be your teacher, a parent, it might be a pastor, anyone whom you can share your feelings. There's no shame about sharing our problems. This is especially important for guys, for men. Usually women, girls are more emotional, they're willing to share about the emotions. But I find that, young men, that myth is that I have to be strong. Men should not cry. But they tend to hide their emotions. But then what the problem is, later on, they go into addiction, into alcohol and drugs and substance use to take care of their emotional problem. So especially for the guys here, for the young men here, not to be, there's no shame in saying that I have problem, but to be willing to, you have a counselor there, Dr. Bhadati, which can go anytime, share your problem, and just sharing. You might not get any very special suggestion or special advice. Just sharing your problem, it's called ventilation, goes a long way in lightening the psychological load that we carry around us. So something about mental health of college students during COVID-19. Studies have shown that around 50% of students have a mental health problem. And suicidal ideation, around 25.5%, is significantly higher for the young respondents, 18 to 24 years of age. And obviously during the pandemic, compared to adults, I think it's usually the young people, children, and old people who have the most problem. Young adults, especially because they value greater social connectiveness. You tend to be social. You like to have friends. You like to meet people, and because of the pandemic, these are highly affected by the lockdown. There's a home confinement. So as we have found that especially young students, school children, and even college students, because of this lack of social activities, has led to emotional problem. But fortunately, this is less now, and I think we make use of this opportunity to start connecting with our friends, with our families, and to. But the sad thing is that I've been discussing with some teachers for school children. Nowadays, school children, they don't know even how to wish their teachers, it seems. Past 1 month, the school has started, and when the students come to school, they've forgotten how to wish their teachers. Sometimes they've forgotten how to make friends offline. Online, they know how to talk with others, but once they meet offline, they've forgotten all the social skills. So that's something which we have to regain these social skills again. And hopefully, as the pandemic stops, the social connectiveness will improve and will help to reduce this emotional problem. So one very important take-home message of my talk here is about the stigma discrimination which we see. Like I said, I work in sun care, and recently we had there was a family the person has a boy has a drug problem. He had, attempted, he had cut his wrist, attempted suicide. He didn't want to live anymore. And he needed admission. And there's no place to, you cannot admit in rehab center. Other rehab center, he can run away. But once we say to come to Sun Care, to the psychiatric rehab center, the family says no, because of the shame. They feel ashamed to come to the center. No, what will the community say? What will people say? So that stigma is still there. Of course, it's much less compared to before. But like I said, when we say about mental or emotional problem now, we're not talking about the severe disease. We're talking about common emotional, psychological problem like depression, anxiety, which all of us have. So there's no shame of meeting a professional or sharing your problem with others. So public stigma is defined as a problem of knowledge, ignorance about the illness, ignorance about what people are going through. Then problems of attitude, we tend to have prejudice, bias, we look down on other people, and problems of behavior. Once we have the prejudice and bias, then we discriminate on others. So this if anything you remember, I think you should remember this, that as a society, we have to break down this stigma and discrimination against, not to be ashamed of it, even in ourselves. If we feel we have emotional problem, to be willing to talk about it, willing to meet someone, willing to meet the professional, a teacher, not to hide the problem, not to say that I'm strong, that nothing will happen, but not to be ashamed of it, but willing to seek help. And secondly, not to stigmatize or discriminate. If we have especially if you see other people have this problem among the students group, you might find someone who's weird, someone who cannot talk properly, does not dress properly, have some weird behavior. They cannot talk. They cannot talk in a strange way. And there's some of their problems. But then, and other people, they tend to, discriminate, stay away from them. But those are people who need the most help. We don't know what they're going through, the genetic problem, the childhood problem they have gone through, what issues they have gone through in their life. None of us know. We just see that they look strange among us, and we tend to avoid them. But then, those are the ones who need the most help, because that's what we have seen over the past. In our experience, that one of the causes of mental illness in young children is bullying. People get bullied in school, in colleges, and then they develop problem later on. It's a very big problem, bullying in school and colleges. So it's something which the students themselves have to take responsibility to stop this problem of bullying among your core students. To look out for those who are weak, those who are poor, those who appear different from the rest, to understand that they have problem and they need help, and to remove the stigma and discrimination. So that is one take-home message you want to give to all the students, and especially in your college. You're very fortunate to have Dr. Bhadrati. She's a very good counselor. I've worked with her, and she's very spiritual. If you have any spiritual problem, you can even approach her. So those who have problem can easily go to your student, to the counselor with whatever problem you have. Then something false. One more reason for stigma discrimination is this false depiction in media. I think we all understand. What the media usually just tend to to show the movies, the news, something which is, of course, when now also in the media they're talking more about the mental health issues, which is good. But recently the movie, they say it's the Hindi movie, Kia Mental Hai. Then they change it to Kia Judgmental Hai to remove that stigma. So this type of stigma is still there in the media, which we have to look out for. So young people do not seek mental health or mental problems due to characteristic features about fear of lack of confidentiality, peer pressure, a desire to be self-reliant, lack of knowledge to recognize mental health problem, and lack of awareness about mental health related services. That's why we don't seek help. But then, like I said, we need to seek help. Anything. We'll be looking at the red flags. When should we seek help? So most common mental health issues in young adults, these are the common things. Anxiety, depression, substance addiction, personality disorders. And less commonly is bipolar disorder, schizophrenia. Bipolar schizophrenia is a severe mental illness, which is not so common, but the one above are the very common mental illness which people can have. So anxiety is a normal emotion. It is adaptive since it promotes survival by inciting persons to stay away of dangerous places. I think we all answer. Because anxiety, that's why we study before exams, that's why we work hard. But this anxiety is an umbrella term for all anxiety spectrum disorders, which includes something called generalized anxiety disorder, GAD. You tend to worry a lot. We won't go line by line, but GAD is having excessive worries about the future, feeling on edge, feeling restless, cannot relax, trembling, sweating. You might have panic attack, increased heart rate. So these are some of the signs. If you feel you have worries which keep on coming. Before it was never there, but then all the worries just keep on coming the whole day, not able to relax, not able to concentrate on your studies, feeling restless, sleep problem. Then you might have a generalized anxiety disorder. There's something different from anxiety is depression. And when we say depression, see, we might all feel sad sometimes when we fail exams or when we have a breakdown relationship. But depression is something which affects our physical, emotional, and social development. And when we say depression, the person will feel sad. It'll be continuously for more than 2 weeks. Not only sadness, but there will be, you cannot enjoy watching TV. There's a sleep problem. Sometimes you might have suicidal thoughts, less appetite. You're feeling tired, feeling weak, cannot get up in the morning. All these symptoms, when they're combined together, then we see that the person have a depressive disorder. And these are the risk factors. There might be a family history of depression, parental conflict, poor peer relationship, deficit in coping skills, negative thinkings. All these can lead to the problem called depressive disorder. These are some of the symptoms. If you feel sad, usually more in the morning. When I get up in the morning, I cannot face the day. I'm feeling sad. I feel like crying. And hedonia means I cannot enjoy. Previously, I like to play football. Nowadays, I don't enjoy playing football. I don't enjoy talking to people. I don't enjoy watching movies. I feel lethargy, loss of energy. So increase or decrease appetite, decreased sleep, not able to sleep at night, feeling restless, agitation. So all these together can lead to other symptoms of depression. Then feeling of worthlessness. I feel I'm not good enough. It's no use to live. I feel hopeless of the future. I feel helpless. Sometimes feeling guilty. I feel like I'm a sinner. God will not forgive me anymore. So regarding thoughts of dying, suicidal ideation. If we have these thoughts together, then something which indicate that we might be going through a depression and we need to seek help immediately. Okay, yeah. So we won't go to this. I think lockdown is over now. Looking at some of the protective factors which will help us in this time of to promote mental health, to prevent mental illness, is to have good coping skills and good personal resilience. So what is a coping? What do you mean by coping or coping skills? Coping skills are the thoughts and actions that individuals use to manage and reduce the traumatic and stress coping situation. So different ways we can manage the impacts of a traumatic and stress-inducing situation are the coping skills. So what are the some positive coping skills? We'll just go through quickly. I think time's nearly over. Deep breathing. If you feel you have anxiety, panic, is to learn to deep breathe, relieve stress through slow deep breathing. You take 5 slow deep breaths right now, and you'll feel calm, and you can calm yourself down. Sometimes when we have this panic, anxiety, palpitation, you just take a deep breath. Try to concentrate on your breath. Try to distract yourself from all the negative thoughts, all the fears and worries that you might have. Then practice staying in the present moment. There's something called, which nowadays they use the word mindfulness therapy. Worrying will not change your health situation. You try meditation or guided imagery. Just as you take deep breath, just relax, close your eyes, and just stay in the present moment. Listen to the sound, listen to your heartbeat, listen to how you're breathing. Not to concentrate on your worries, on the tension that you have, but to be mindful of the present moment. And I think all these things, this breathing exercise, relaxation exercise, even Dr. Bharati will be able to teach the students. Then using something called CBT, cognitive behavioral skills of therapy. Remember, how you think affects how you feel and how you behave. So sometimes you cannot control your emotions, you cannot control our feelings, but you can control your thinking. If you're having a negative thought, I might have COVID-19, I might get sick. So change it to a positive thing. I will be healthy by taking good care, practicing good infection control. Of course, this is about the COVID-19 thing. So to repeat this positive thinking statement several times a day, just repeating this positive statement. And as you try to change your thinking, the thinking become more positive, then your emotions also become less. So this is called cognitive behavioral skills, which if time permits, we can go through more. So different ways of reframing, changing the way you look at and things in order to feel better about them. The same way, we just use this technical term of reframing, but no, all these negative thoughts that we have to replace it with some positive thoughts. Then social support from a counselor or a support group. I said earlier, a support group, a self-help group is something which we really, if you see like people with, suppose people with cancer problem, they tend to meet together and they help each other. They discuss the problem, they share skills, they're able to support each other. And nowadays in the hospital, in different way, we have these different self-help or support group. So similarly, even in schools and things, you have all different type of groups, no? Your sports group, or maybe your drama group, your debate group. You can have something emotional support group where people can, without any fear or shyness, can come together and support each other. So this is one thing which we can do in the colleges. Then another way coping skills is to stay active, physical activity. Just playing football, jogging, going for work goes a long way in reducing mental health problem. Then talking to someone, like I said, just sharing your problem to other people will really help in reducing this stress. Sorry, this thing is about COVID, so you won't know about good infection control. Yeah, so these are few coping skills which we can think, but I think that time is less. So I want to have more interactive of question answer. So with that, I'll just end my talk, but I just want to emphasize again that mental health is important. So let's not shy away from talking about feelings with one another, with a teacher or a counseling. And it's okay to be to not be okay. No, you don't feel that I don't have any emotional problem. We can willingly say that yes, I might have problem. It's not that I don't have faith. It's not that I don't believe in God. But then, in spite of that, in spite of it, each of us goes through a lot of emotional turmoil. And if needed, we need to seek professional help from counselors, clinical psychologists, or even psychiatrists if you feel that we need medication. So thank you so much. And yeah, if we have any question and answer, questions. I think any question from the chat box? Just hold on, I'll just close the. Yeah, if you have any question, you can unmute yourself, or you can click in the type in the chat box.
Okay, thank you so much, Doctor. Sorry, I just got disconnected just for a minute. Okay, actually from our students, I think there was a question. So I'm just reconnecting.
Dr. Bharati, also, if you have anything to add, maybe you can also
Exactly.
share.
I lost the question. Bhatrati, can you just see, because I got disconnected because of the system, can you just read out that question that a particular student had asked Doctor?
You mean
It's
Ronaldson
not, it's,
Surong?
must be, because it's not reflecting in my
All
system
right.
anymore.
Okay, let me just check.
Yeah. He was
Okay,
asking about
this.
his concentration in the class and the teacher, something he was saying.
Okay, okay. This one from Ronaldson Surong.
Yeah.
Respect, doctor. Why sometime for me I cannot realize what I've studied. Like when today our teacher is explaining, but only at that time I remember the explanation. But when I reach home, it looks like I forget, and I started looking in my copies and read again. But there's some time also where brains is not working. So it is because of our health or what, doctor? So that's the question from Ronaldson
Yeah, I've
Surong.
seen that, yeah. But there's something also. Okay, so it's something I think all students go through, no? Where you have listened in the classroom, but when you come back home and you forget everything. So if it's really disturbing you, I think one reason is maybe you might have not concentrate what you have written down,
Maybe.
or maybe not listen properly to what the teacher has taught. I think if we concentrate in a classroom, sometimes we just take notes. Everything is a spinal level. You might be just be taking note without already concentrating on what the teacher is teaching. So I think if we really make up our mind to concentrate at that time, I think it'll help us to retain in our memories. And once we come back and look at the notes again, I think it should help us to remember. But then if it's something which is, even as you try to concentrate also, you're not able to do it, then yeah, you have to look for other, it might be, because like I said, in depression also, one of the symptoms is lack of concentration. When you feel depressed, you're not able to concentrate on any work. Your mind is not sharp and active like before. So if you have other symptoms like disturbed sleep, as I said, feeling of sadness which continuous, tiredness, feeling anxiety, along with this concentration problem, then it might be that you are going through a mild depression, which will need help. And depression is something like we say, depression is not necessary that you have to take your medication. Sometimes like just sharing with a counselor, just talking whatever stresses you have with other people, doing physical exercise, jogging or any physical exercise that itself helps in removing these depressive symptoms. And sometimes even if these things does not help, then you might meet a psychiatrist, and sometimes mild medication can be given if for depression. So again, for the medicine also, again, this myth is there, the fear of taking medication. Sometimes you feel that you will become addicted, or if I meet a psychiatrist, that means I'm mad. But I said, now past 2 years, people who are coming to psychiatrists are many people with this type of disorder, depression, anxiety, which is more and more common. So once if you meet a psychiatrist, doesn't mean that you have any mental illness. It might be that you have some emotional or psychological problem which can be helped. So the teachers are here. Maybe they can also add to this problem of not able to concentrate. I think the teachers will know better how to help the students concentrate in the classroom.
Yes, absolutely, doctor. That's right. I think teachers also, that's why we have the mentoring. We just the other day, Ms. Bhattati gave us an orientation about mentoring to teachers. So I think we teachers, we have benefited a lot from her orientation, like how to understand the needs of the students, how to understand the minds of the students, how to understand the behavioral change of the students. So I think we have to go back to that, the background and the environment of the student, why he behaves like this. And one thing that I captured from what you were saying is that we should be, you said that we should be less judgmental.
Yeah,
I think that's one of the main drawbacks that we have as a community, where we are so fast in judging people.
that's true.
No, I think we have to be less judgmental to understand why people behave like that. Sometimes you judge a student by the way he dresses,
Yeah,
oh, by the color of the hair, by his earrings,
yeah,
by this, by that. But then sometimes people they let out the anger, they let out the angst, or they try to look up for a different identity just to be accepted in the society.
that's
Or
true.
sometimes they take shelter in that new identity. No, I just feel, doctor,
Yeah,
I
that's
used to have a friend of mine. I used to have a friend of mine from a different community. She would like to color her hair yellow, and then she would say that I'm like a European. So she has been living in that identity, false identity, that being accepted, like I look like a European, I feel more accepted.
yeah,
So it has to go back to the family, because her parents have always expected her to be to be expected something the best from her. Maybe she was considered the black sheep of the family, so she took a different identity.
yeah,
So I think we teachers, we have to be less judgmental. We have to understand why students behave like that, why they are like that, what
yeah.
makes them like that. No, I think, of course, it's a long road ahead. It's not
That's
easy,
true.
because with your experience, I mean, what we are saying is just a tip of the iceberg. So we
Yeah,
really
being
have to dig
judgmental, I think all of
inside.
us tend to be, I mean, our human nature is like that, to someone strange from us to look down, including me. But for joining this field and talking to our patients, talking to people and understanding the issues that they have from childhood,
Yes.
you really understand what they have gone through, the family issues, the childhood issues, then you really understand them and you cannot be judgmental anymore. I mean, each and every person has their own history, that negative history that they go through. And what they need is help, not to be judged by others. So I think for me it's easier because I spend time with people and talk to them. For others, they just there or just see the person just for 1 minute, so it's difficult. But then to understand each and every person and to actually just bullying among students, no, is really a big issue. Previously, it was not there in our
Yes.
Shillong school and colleges, but now it has started, and something which the students themselves have to take responsibility for this to fight the bullying.
I think it
There's
was
one
there
question
before,
here.
but it was not so. Okay, okay.
Yeah. Another question. What if a person takes up drugs continuously? What are the measures to avoid this to be a better person? So it's the issue of drugs. And again, yeah, drugs is a big issue nowadays. We know how it's a big, another epidemic similar to COVID, the drug issue. So if person take up drugs, and if you see drug, I mean, I think maybe the illegal drugs. So maybe for alcohol and cigarettes, there's sometimes the social use is there, and later on it can become an addiction. But for these illegal drugs, like when you say drugs, we mean something called heroin. That there's no social use at all. At from the beginning only, it's addictive. It becomes a addiction. So there's no question of taking up drugs. Those have not experiment. It's not to experiment at all. You should not don't say that, I
Of
as a young
course.
people I should have fun. Sometimes it's all right. Drugs is something you have to avoid completely. Drugs, I mean, something called this weed, marijuana, cannabis is a total no. And again, and if someone has been using it and you are having problem, again, you should accept that it is a disorder. Uh, you need help. Maybe just don't feel that, "No, I can stop by myself. If I have the willpower, I'll stop myself." Because if you have started drugs, then there's no question of willpower. Stopping by yourself is difficult. You need help. So accept that it's an addiction, it is a disorder, and to seek help immediately from a counselor, from doctors, from professionals. And once you have stopped, also to understand that the temptation, the relapse will keep on occurring. So even after people have stopped, you have to keep on taking some medication to continue the counseling to prevent relapse later on. And if it's quite severe, the person says, what if a person takes up drugs? I don't know how severe it is. But if it's very severe, if the person is not able to stop, then again, these rehab centers, there are many rehab centers which you need to stay, because stopping drugs, as you know, people are addicted to it because it's very difficult to stop. If you stop, there's withdrawal symptoms where it's very difficult to give up. So sometimes you need to stay in a rehab center for maybe 1 month or 2 months to help you to stop, to teach you skills to prevent relapse later on. So that's one question about, I think, drugs addiction.
Okay, Dr. Eddie, I think in addition to that as well, there's a smartphone and internet use addiction that is also
Yeah.
there, especially during this pandemic and even after pandemic. So which we can see symptoms like restlessness, anger, or irritability, and then craving access to smartphone or other devices. So yeah, I find that this is the problem that students are going through.
Yeah, there's a question on that also. A person addicted to playing games, like
Playing games, yes.
Free Fire, no, PUBG, not something PUNG, PUBG.
Yes, yes.
Yeah, that's that. Yeah, so that is thing. And again, even the WHO previously when we talk about addiction, no, previously addiction means mainly alcohol or drug addiction. But just over the past 1 or 2 years, the WHO has put this gambling and internet or video game addiction as disorders. That these also are disorders, like disorder of alcohol. That when you become addicted to it, it becomes a disorder. It's not just thing normal anymore. So it is a disorder which needs treatment for these video games. So again, for people having this problem, so one thing is, if you learn to recognize it, that's the first step. To recognize that you are addicted to video games or to internet or to any media addiction. And sometimes when you stop, you tend to have withdrawal symptoms similar to substance addiction. When you stop the video game, you'll feel restless, you cannot sleep, you're not able to concentrate on your studies. So it's so the first step is to recognize that you have a problem, and once you recognize that, it's to sometimes people say that I will reduce slowly, I'll stop it slowly, but then that doesn't happen. This reducing slowly doesn't happen at all. What we usually teach people is to make a deadline where you decide to stop completely. We're supposed, even if it's a problem at night, where I usually start playing video game, maybe at 9 p.m. you give your mobile or your mobile or your tablet, you give your parents, don't keep it with you. You have to take drastic measures. You can't say I'll keep the mobile with me, but I won't play video game. The mobile is with you. The temptation, that craving will always be there. So it's good if you can give off the mobile at night to someone. Then you meeting a counselor, because video game you might have other issues, other depression, anxiety, other issues which will make you addicted to the video game. So to discuss counselor and discuss about other issues and other topics. And sometimes if it's very severe, it becomes like an addiction. Sometimes even medication will be there to reduce these obsessive thoughts, reduce the craving that you might have for playing the game. So even medication might play a part to those who have been diagnosed with this internet disorder. Yeah, so that is one way we can help. But anything you want to add on that? Addiction to internet.
Okay. I think that's all. I mean, you said it all, sir. I don't have anything more to add.
Understand, it's the first step to realize it, understand it's a disorder, and to seek help, even for these if you have things. But of course, prevention is better than cure. If you feel you're having a problem, to try to cut it down. If you feel this internet video game addiction is taking too much of your time, to fix a time. If you want to play, fix a time just for that, maybe 1 hour or something, and then stick to that timing which you've put for yourself, and want that to continue.
I can't see him now.
Okay, yeah.
Doctor, can you
Any
see us?
other
Because I cannot
questions?
see you. Doctor, can you hear me?
Yeah. I can hear you.
Oh, okay, because I cannot see. Oh, okay, fine. Okay, students, you can come with more questions.
These
I
are
think
the
so far they've asked. Yes.
So if any other questions, I think the time is already
No,
11:41.
personally, yeah, I think personally, doctor, our students are very lucky to have this kind of to have the cell, like the mentoring and the value education cell or the counseling cell. I used to remember many years back, when we never thought of having such a cell in schools and colleges. No, I think so. Our students are very fortunate to have this facility in their respective colleges where they can go and share you know, their anxieties, their stresses to the counselor.
Yeah, that's true. I think government also
Yeah,
has
because
realized the importance of this. That's why it's
yes,
compulsory to have a counselor, a school counselor, I think, in every educational institution.
exactly. Because
Yeah.
I used to remember, whenever we talk of mental health, no, earlier, I mean, quote unquote, people say pankhle, oh, go
Mm.
pankhle, huh? Not knowing what is the reason, why is it so, and the rest of the community, rest of the group also they agree to that when someone says someone oh pankhle.
Mm.
So recently I came across, Prince William. He said one he said one quote, and it has become very popular now. He said that, which reminds me of what we used to say in our communities. He says that mental health, okay, is not a dirty word. We all have mental health, like we do for physical health, whether good or ill. So just like physical health, so also mental health should be treated the same. No, we should not say that, oh, this is pankupta, like that. I think we should remove that. So I think this time we are more clear with what mental health is. Students now they know. So I think students should take this message across. What is mental health? Just like physical health, mental health also. If we need to address a certain issue like physical health, so also mental health. If we need attention, medicines, and care, like physical health, mental health also is the same. It applies the same. So I think our students should take this message across to their communities, to their localities, to their families that, mental health is not something that should be stigmatized, but it's something that we just need to address in the same pattern as we do towards physical health. So that's my encouragement to our students from this talk with you also.
And thank you, ma'am.
Hello, doctor. Hello,
Yeah,
doctor, are you
that's
there?
true.
Okay, we couldn't hear you just now.
Yeah, I think if you don't have any more questions.
Yes, students, do you have any more questions? Even teachers also can ask, no? Teachers also, you can just raise a hand or ask a question in the chat box.
You can just unmute directly and share. Yeah.
Exactly, and just share. See, we don't get this opportunity. Not only that we don't have time, but to call a resource person like you, it's so difficult. You're so busy. So I think we should take this full opportunity to ask certain questions which relates to mental health. So teachers, if you'd like to ask any questions, you can just unmute. Okay, while we wait for that, for the sake of our students, I think they should know that this mental health, it has been, we should be glad that it has been accepted in the Sustainable Development Goals of the United Nations. Okay, and if I'm not wrong, in 2015, the UN Sustainable Development Goals has accepted mental health to be part of the 17 goals of the SDG. Now, that is a historic step by the United Nations, where the United Nations has acknowledged the burden of the disease of mental illness, and it has defined that mental health should be a priority for global development for the next 15 years, which means that by 2030, mental health area should be addressed by all areas, sections of the community, stakeholders, INGOs, GOs. They should accept that as a priority. And not only that, UN has recently added this in the SDG 18, which is space for all. So our students should know that with the SDGs 80, SDG 18, which comes after the SDG 17, space for all means even students with mental problems, mental health, mental issues should be part and parcel of the system. They should have space in the institutions where they can share their woes, the anxieties, and no other person should look at that student differently. Just as we talk about children with disabilities, where they have to be included in the system, in the education institutions, so also such students. We know that, I think Bhadrati will agree with me that I think every year, or after every 3 months or 6 months, you see students coming to you and they're increasing, looking for help, seeking for attention, looking for alternatives, what to do, or they're going through certain situations. So it means that because of pressure and what the doctor has uh, shared about the reasons what made students more anxious, or the anxiety level is growing higher because of many things, because of what to say, because of economic crisis, because of gender imbalances, and because of family problems, because of parent separation, because of abuses. So this has led to more mental health problems. And I think that we have never seen a day and age where children are being more vocal nowadays than before. Before it was a silent killer, no? But I think now children have come up, and then share their problems to people, to adults.
And to add to that, ma'am, like you said, the problem is quite big, and we need
Yes,
also more people to help.
absolutely.
So in Sankya now we have a training program for counselors starting this year
Okay,
for teachers don't
okay.
want to know more about counseling. And there are many training programs, actually, like online programs are there, counseling from different
Okay.
organizations, from CMC, Gallo, from NIMHANS.
Oh, oh,
So
okay,
even
okay.
in Sankya, so now we have started a counseling course. It's just twice a week where people can come here, get some theory
Okay.
classes, and then mainly practical. Talk to the patients that we have here, how to help them, what are the techniques of counseling. So it's good
Okay.
if both students and teachers are interested, because I said the problem is number of people are more having problems is getting more and more. So we need more and more
Yes.
of counselors and therapists, and because even in our state, it's the number of psychiatrists, psychologists, trained counselors very less. So just short-term training will go a long way also to be part
Yes.
of the workforce.
Exactly.
So those who are
I.
interested can contact us in Sankya
Oh,
for
okay.
this
Sure. Sure.
counseling
That's
course.
nice. This Bhadrati can tell us, no?
Yeah,
We can connect with
I can
doctor.
inform Bhadrati also. Yeah.
Okay. 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 This is nice because I think you see this is where where we talk about the support system, no? So for every issue, every problem that a person has, there has to be a strong support system. So I think this is where you're saying about how others can go for these trainings, and they can provide the support system to that particular person.
Because just
No?
waiting for the psychiatrists, psychologists, I mean, they're too few,
Absolutely.
too few. So even the government is also
Yes.
planning to, to increase more training so that people can have some experience about counseling. It's not very
Yes.
difficult.
Yes. I personally have experienced one very good successful story. Okay, a good success story outside when I was outside the state. I remember I used to be close to one family where the son had this mental issue, and every Saturday the mother will go to these counseling classes and then training classes. So she was a real strong system to the son, and it took the mother for about 4 to 5 years, okay, to walk together with the son. And because of the support system we got from his mother, which she got the training from the rehab center. Okay, now the son is doing very well, and he's got a family. He's, just such a beautiful story. I mean, I've seen their journey, and I saw how, like, if good support system is there, there'll be more success stories, and children will come out of that situation faster. So I don't think so. Are there any more questions, Doctor? I think your presentation has given us enough information, has guided us enough to take this forward. So, but is there anything else you'd like to add?
Okay. Well, I don't have anything more to add because Dr. Eddie has given us all the information that we all need to hear.
Yes.
Yeah, thank you. Thank you.
Can Doctor share the PowerPoint to Bud so that we can see? It's so informative.
Sure, I can send and I can send to you.
Yeah. But from the college level, I was just thinking, since 10th of October is the Mental Health Day, maybe we can carry out a campaign or something. We can have a campaign on mental health.
Yes, that's a good idea. We should do.
No,
we should do
I
that
think
program.
yes, because I remember last year when I saw that. I mean, of course, people who will be for or against the country, but then that is the United States. I saw Hillary Clinton that campaign on this issue. Okay, where the slogan was that the next generation must grow up knowing that mental health is a key component of overall health, and there is no shame, stigma, or barriers to seeking out care. So I really like that slogan, no? So I think we can do something like that, no? We have a campaign and come up with a slogan, like Shillong Commerce campaign on mental health. Then we can maybe again seek doctors' advice how to go ahead with this campaign. I think we can start, no, from this from our level.
Which is very important. I feel like we need to promote, mental health, because like Dr. Eddie said that, we need to promote health actually right from families with our children, small children.
Yes.
So not only in college, but also from a college, we can do something like to promote this mental health to all families, so that to conscientize people in our society as well, that they should come out of the stigma and discrimination. So campaign is one of the factors that can help us do something for our society and for everyone who needs help.
Yes.
I'm so grateful to the Shillong Commerce College for that idea. Something's very needed. October 10th is World Mental Health Day.
Yes.
And even in June 26th, that is International
against,
Day Against Drug Abuse.
Day against substance abuse.
Because drug also is a big issue, which is part of mental health.
Yes.
So June 26th is another day which we can celebrate.
Okay, that's fine. So we will keep you in the loop, Doctor.
Yeah, sure.
Okay, so I think we don't have any more
questions.
So much, yes. So students and all participants, we have come to the end of this session and this wonderful talk that we've had with our respected doctor, Dr. Eddie Mukim, who's again, I'll repeat, he's the consultant psychiatrist of Sun Care Rehabilitation Center. I think you all know what is Sun Care Rehabilitation Center. Where is it located? It's somewhere in Mauro. So the moment you reach Mauro Point, there, if you ask anyone, everybody will know where to take you to Sun Care. And I would also encourage students, if they are interested in doing research work or some case studies, so they can. I think it's not difficult for our students to connect with Sun Care, since we already know the point person, Dr. Mukim. So I hope, Doctor, if there are students who will be interested, because I teach sociology and we do have projects, we do have research work, so maybe we can encourage our students to do some case studies or some research work.
Always welcome.
I mean, not now, but in the future.
Yeah, sure.
So yes, and also Doctor is working is helping in Robert Hospital. So okay, Dr. Eddie Mukim, thank you so much for the wonderful time. We respect your time and we honor the contribution that you have given in this talk. So may God bless you and continue to use you in your future endeavors. And we pray that just as we've been blessed through your talk, so much so will be the people or the patients who are there at the center, that they'll be blessed by your presence and by your care. So,
Thank you
okay,
so
at
much.
the end, yes. So at the end of this talk, at the session, I'd like to thank, once again, I'd like to thank the principal, Dr. Sen, for allowing us to hold this program. I'd like to thank Ms. Bhadrati Ranga, who's the counselor and of the mentoring and the evaluate education cell, and to all the team members of the cell. Thank you so much, friends and colleagues. Okay, your support has made this program a success. Then to all the teachers also of Shillong Commerce College, uh, your support to this cell is tremendous by you attending the orientation training that happened on Monday. So thank you so much, and we look forward to your support in teachers in the days to come on the mentoring aspect towards students. I'd like to also take this time to thank the IQAC cell, the coordinator, for encouraging us to go ahead with this program. And I'd like to thank Assistant Professor Samantri Prasad, who's just next to me, to my right hand side. He's a technical person here, and he has gone beyond his job description in assisting us and making this program a success. Thank you so much, sir. And we also like to thank our dear students who have spared their valuable time in listening to this talk. And students, I hope that you have all benefited from this program, and please take this seriously. And if there's any help, anything that you've learned from this and you want to take back home, or you want to address your issues and your concerns, you have Miss Bhadrati. There's the counseling cell, you know the room. You can go to that room and talk to Miss. And slowly teachers also will pick up when we have selected who our mentees are. So thanks to each and every one of you, and thank you, Doctor, again, once again. So may God bless you. Thank you, everyone. Have a blessed day.